What's up, everybody? Dr. Perry Bard here. And on behalf of Dr. Eric Kaplan, we cannot tell you how happy we are and how excited we are for you to join us here on something that you haven't seen before. Yeah, new stuff, new content, new tools, new information. And we want to welcome you to the Decompression Success webinar. Now, it's very funny. Doctors often ask us and they'll say, well, gee, who is this really for? And I'll tell you who it's for. If you really want to know who it's for, I'll tell you who it's for. It's for, number one, it's for doctors that already have decompression tables. And they say, well, gee, you know what? I have 3 tables. But I know that there's a lot of doctors out there, especially part of this centers of America, that have 4, 5, 6, 8, 10, 12, 13 tables. That's exactly correct. We're not in the table business. So regardless of whether you have an Acuspina, a DRX, a Spine Med, a Triton DTS, a Kennedy table, a Hill table, a Doc table, I mean, we can go on and on. The goal is that you create a capacity situation in your office where now it's incumbent upon you to fulfill the demand, meaning you're helping enough patients avoid dangerous opioids, risky epidural injections, and often unnecessary back surgeries. That's the goal of having spinal decompression. That's the power that you have in spinal decompression. It's also for doctors that have basically that they bought a table and basically the salesman said this is what you need to do, and then they kind of can I say it? They ghosted them. They ghosted them. So that's not cool. So what is cool is knowledge, power, information, education, and that's why you're here. So credit to you guys. And then the last group is a very interesting group to us, because those are the doctors that actually, believe it or not, they don't even own a decompression table. And guess what? That's cool, because you're with us here live, right here, right now. We're ready to learn. So I think that's important, because I think the more you learn, and there are tools, and we're going to talk about the tools, and we're going to talk about content and information and education and how to get your hands on certain things and trainings and all that cool stuff. So if it's cool with you, let's go right into it. If it's cool with you, raise your hand. See, now I know you can hear me, Dr. Mitchell. Oh, I know you're always there, larger than charge. And by the way, that is a heck of a baseball jersey, DCOA. Did you get that from us? Was that a gift? It might have been. It might have been. So what I'm going to do is this. I'm going to share. This is how we're going to work tonight, okay? I'm going to share the screen. I'm going to show you a couple of things. But before we do that, if I can tell you any word of advice, this is what I would tell you. Shut off your phone. Unless you're watching it on your phone. Close the door. Don't take any calls. Don't serve. Don't do anything except concentrate on the content and the information, because we know this. We know that one piece of content, one phrase, one idea, one piece of research can really make the difference for your patients short-term and long-term. In other words, to be able to help your conversion rate, number one. Number two, attract better quality patients. And number three, get to yes. Because if you don't get to yes, what happens is the patient often will end up with other options that are not as good as your options. So let's dive into it, and the room continues to fill. So it's very, very cool. We're very excited for that. We have a great turnout. And so I'm going to do this. Let me share my screen, and let's hit the ground running. You ready? So here we go. Let's see. Can we do that? Do you see that? There we go. All right, beautiful. So what I'm going to do is wow, how cool is that? I'm actually going to do that. So I'm going to minimize mine, and so I can look right at you. That's exactly right. All right, take some notes. The greatest thank you to Dr. Kaplan and myself is doctors that put their heads down. And anytime we give, master classes, certifications, workshops, trainings, seminars, boot camps, chiro events, when doctors are going and are writing, it tells me that we're basically unlocking different areas of their brain to create ideas and to-do lists and things that they're going to change, enhance, modify in their practice to create a better dynamic for their patients. So let's go right into it. And here we go. All right. So I've never showed this before, and for the right, and some of you will get this, and some of you won't, but it's all cool. So there was an album that came out many years ago. It's actually one of my favorite albums by a group called The Who. Now, for some of you, you probably never heard of that, and for others, you may really dig this group from England. I happen to really love them. They came out with a song called Who Are You? It was so popular, it was even the title of an album track as well. So the question that we're going to answer right here, right now, live, is who we are. And because the reality is that there's a lot of people on this with us right here, right now, and they know exactly who we are. They've been with us for years. Their practices are booming. They're exploding. They love it. Their quality of life is amazing. Their freedom is incredible. Their bank accounts are very cool, and they're good students of the game, and they've wrapped themselves into their brand. But the reality is there's also a lot of people who don't know. So who are you? Well, I'll tell you exactly who we are. This webinar, Zoom training, whatever you want to call it, is really being given by two doctors. The first doctor is someone I've known for 38 years. His name is Dr. Eric Kaplan. He is, without any shadow of a doubt, and you could ask anybody, he's the heavyweight champion of this stuff. Do you know what I mean? He knows, he has done the deep dive beyond measure when it comes to all the research, the science, the clinical data, and all the new content that's coming out. He is the chairman of the International Disc Education Association, CEO of also Disc Centers of America, also the author of an 800-page book. I could rant and rave about him. I could do a whole Zoom meeting on him and just talk about his resume. And me, I'm just kind of a guy that loves this business. I love being a chiropractor. I've been a chiropractor for 30 years, and I was actually Dr. Kaplan's associate doctor 38 years ago, right? So isn't that kind of wild, right? I mean, listen, if a relationship is good, it's going to hang out for a little bit. If a relationship is great, it's going to hang out a lot longer. And if a relationship is historic, then guess what? It's going to stand the test of time. 38 years we're together, and guess what? Every day has been better than the previous one, and I can go on and on. But we're having so much fun because the spinal disc business is better than it's ever been, and that has a lot to do with some of the information, and a lot of the information we'll show you here and more. So a lot of doctors say, well, gee, I know exactly who you are. They do. They say, yeah, you're concierge coaches. You're coaches. As a matter of fact, not only are you coaches, you're also consultants. And more than that, I know a lot of doctors that you've helped, saved, trained, educated, and mentored. So you're really more of a mentor to a lot of those doctors. And as I've told you before, not only did he write the 800-page book, he's actually a 5-time #1 best-selling author. 5 times. It's cool if you're just once, but he's done it 5 times. We're also advisors. We're confidants. I guess we're soundboards. I guess you can call us a lot of things. But if you really want to know who Dr. Kaplan and I are, what we really are at the end of the day, and I think it's a thing that personally myself and Dr. Kaplan are the proudest, is we're educators. And being an educator is a lot easier said than done. And being being a teacher especially doesn't always get all the respect, although I don't know 2 doctors who get more respect in this profession than Dr. Kaplan and I. And that's not because of us. That's because of all of you. That's because of your appreciation, your gratitude, your ability to share the love, and that goes. Loyalty is a big thing with us, as you probably know. If you look in the dictionary under doctor, the word doctor is actually teacher, and that's one of the things we actually tell all our patients. We actually tell all of our patients that the Latin word, actually, doctor, is actually doco, actually, and there's a couple of different versions of it, actually. In the Latin version is to be a teacher, and our job is to educate you. Our job is to teach you. Our job is to empower you. Our job is to make sure that you know as much about you know about your body, about your condition, so you personally, Mr. Jones, can take charge and really have a great quality of life. So we're going to give you things to do here in the clinic. We're going to give you things to do at home. And if that makes sense, say yes. And they always say yes. It's really wild. So we are the largest group of branded non-surgical spinal disc centers in the world. And I know it says 45 states and 220 centers, but guess what? That's an old slide. It's actually over 250, and it's actually 46 states right now, and with a wait list to get in. It's wild. We're not a franchise, as I told you. What are we? We're an educational group, and we just give you all the tools. So one of the things we're incredibly proud of is the endorsement by probably the person, or without a doubt, the person that actually has written the most research papers on non-surgical spinal decompression. He's the most revered, he's the most respected, he's got the most cred in it, and over 500 published papers, MD, PhD, neurosurgeon, the incredible Dr. Norman Shealy, who actually, believe it or not, gave his only formal endorsement to Dr. Kaplan, myself, and our family of doctors, Descendants of America, which we're incredibly proud of. This hangs up in a poster in our doctor's offices. It goes in the new patient package book. See, patients are a lot smarter than you give them credit for. Fact. They'll Google this stuff. Fact. And they want to know that you play on the grand scale in the major leagues, saving patients from back surgeries all the time. So I want you to do this. This is what I want you to do, because last time we did this, I got a couple of text messages. You know what I'm talking about. You know, some of you are actually on, and you said, why did you wait till the end to tell us about the training that's the end all be all in terms of my favorite thing, which is called the Chiro Event. So I'm going to give you two dates right now. It is Saturday, July 12th in beautiful, sunny, tropical South Florida. And then 2 weeks later, yes, this is the first time we've actually put two together. It's the same exact training. So if one gets closed out, you're going to have to go to the other one. And there's only a handful of seats right now. And I asked them to text me the amount of seats before I actually got on here live. So I haven't opened that text yet. I'm going to do that probably while Dr. Kaplan's talking. So there's two dates. I want you to write this phone number down, 888-990-9660. If you want to attend the Chiro Event training, where we'll put more materials in your hand than you've ever seen, we'll educate you, we'll advise you, we'll show you, we'll give you so much content, we'll give you example after example how to explode your decompression practice and more. And guess what? By the way, BTW, there's nothing to sign. There's no contracts. There's no pressure. There's no obligation. It's a day of learning. It's a day of content. So there are two dates. They're both, believe it or not, here's the unique thing about this. They're only done one time per year. Now you might say, wait a minute, can you explain that a little bit? Absolutely. The July 12th training is the only time per year we do a training live in our corporate center in South Florida. So we actually bring you behind the curtain, if you will, and we do the training at our actual corporate training facility in sunny South Florida. We only do that once a year. So that's the July 12th training, and that's why there's such a demand for it. People wait so much, but it's cool because they get a chance to see, basically behind the curtain how everything works. They get a chance to hang in on our training center. It's amazing, beautiful glass building. You'll love it. And then July 26th, 5-star location in Chicago. And it's not a secret, Dr. Kaplan is a foodie. He loves the food in Chicago. We love Chicago. Our son lived there for a number of years. He actually went to college here. He played baseball there. We love Chicago. We only do it once a year. We will be there on July 26th. So those are the two dates. Write it down, July 12th. And there are two websites for it. You can go to the website. You can register online at thechiroevent.com for the one on July 12th. The one on July 26th, you're going to have to call that number because they're down to very, very few seats. That I do know. So they're making everybody call the number, take the information over the phone, 888-990-9660. That's the number. Write it down. And if you're lucky, maybe you'll see that one more time. But that's it. And now we're ready to hit the ground running. We're ready to learn, grow, be educated in something that we all have a curiosity and a heightened sense of awareness on, which is non-surgical spinal decompression. So a lot of the content that you see here tonight that Dr. Kaplan will be explaining comes from two books. The first book is a book laden with graphics and tools and reports and science and even marketing, believe it or not. It's called All Roads Lead to Disc. It's an amazing, amazing book. And in conjunction with that, what we also call the University Edition of the Ultimate Spinal Decompression book. In other words, we created a 400-page version of our 800-page book for all the chiropractic colleges, and we donate those to the schools as well. So a lot of the content that you'll see, and by the way, BTW, if you hang out for a little bit, here tonight, you may be able to get access on. You can't buy these books, by the way. These are not for sale. So there is a way to get your hands on them, and If you hang out tonight, you'll see exactly how to get your hands on these books. It's amazing. These books are incredible. Oh my gosh, this is my favorite time because I get a chance to talk about him a little bit longer, only in the sense that he's just the coolest dude that I know. And the reason why is simple. He is relentless. Yeah, he's relentless when it comes to helping you do better. He just, and that's what I think that's what the best coaches, advisors, mentors, and educators do is they learn how to get the best out of each individual that comes into their universe. He certainly has done it for me, 38 years and still getting better. If you see, I mean, he has probably the greatest, I would say he's got the greatest life resume that I've ever seen. And a lot of the stuff that I'll tell you, like if I actually really told you the quality of his life and his stories about his life, your mandible would drop on the floor right now because you would say, oh my gosh, how is that even possible? And I would say, he did it. He does it every day. He's that guy. And it's so much fun. So what I'm going to do is I'm going to, with your approval, I'm going to stop sharing the screen. I'm going to bring him in. And then guess what? We're going to hit the ground running. So here we go, and let me see. There he is, talk about somebody who's representing the brand. It's very stylish tonight. And Dr. K, yes, LP, lasting purpose, to give, to love, to serve, out of abundance. I just spoke to a doctor. I think I told you an hour ago, who actually booked a seat for Chicago Caravan, and he's actually, it was in the second graduating class at Life University. So he's so excited and excited to meet him and see him there live. So, oh boy, look at all the great doctors. Let's take it away. Dr. K, take it away.
It's a great thing, to be here tonight. And we have a lot to do. And I'm getting right down to business. I mean, listen, I'm not selling anything tonight but your success. So sit back, relax, take notes. But I want you to write down one word. Okay. And I want you to write down the word care, C-A-R-E, care. Because that's what we're in. We're in the care business, and everything comes down to, I love the people that say, oh, I'm getting leads, but I'm getting bad leads. No, doctors, there's no such thing as a bad lead. What there is a bad report of findings. What there is are bad closers. What there are bad responses to the patients. And what you have to do, doctors. Are we good, Para?
Yeah, we're good. I'm gonna get out of there. I don't know why that's on there.
What we got to do, doctors?
I'm trying to figure that out. How to get out of that?
Just keep it on me.
There we go. How's that? Technology, baby. Let's go to work. Oh, look.
So when you write down the word care, one of the things that we do, for when people become a client of ours, or when they come even to the Cairo event, we give it as a gift. We give out a set of videos called the 3 C's. And the 3 C's are the capture, the conversion, the close, because see, that's the business you're in, doctors. Getting new patients, capturing them, converting them, meaning if they come in for chiropractic care, how do they become a disc patient? It's a very amazing thing, and if I sound angry tonight, I am, because hasn't been an easy week for me. Why? I had to go to the dentist. Why? I had a bad tooth. But you know what? The close. He closed me $7,000 later, not $3,000, not $4,000, not $5,000, not $6,000. And guess what? And as I sit here right now, I'm still a little bit in pain. But you know what? When I went to see him, he took a line out of my book. Healing takes time, Dr. Kaplan. You of all people should know that. And that's what we need to talk about tonight, because when people come into your office, doctors, we have to know right now that 6.5 million people are in bed daily due to disability. 5.4 million people are disabled. That back surgery is the second most common surgery held in our country. And anytime that someone's in your area and they're having back surgery, it's because you failed. So watch me said the word care. What does care come down to? Okay, care comes down to, watch this, doctors. The first C, confidence, commitment, and clarity. If you go into a report of findings and you're thinking right away, oh, I don't know if they can afford me. I don't know if they like me. I don't know if they're a candidate. You failed. The dentist didn't give a crap. He said, this is what it is. These are the teeth. This is what we need to do. And this is what it is. No discussions, no negotiations, no management, no discounts. That's the way it is. $7,000. And let me tell you how long this report of findings took. Why is a tool in my mouth? Okay, I'll pay it. I mean, that's the way it works, doctors. But what I found is it's very funny because people don't even know dentistry's been around a long time, longer than chiropractic. Matter of fact, how many of you people knew that Paul Revere was a dentist? Right? He should have said, not only the redcoats are coming, he should have said the chiropractors are coming, because here we are and we're here to stay. You know, doctors, when we look at the levels of degeneration, okay, and I want you to look at the first phase to the fourth phase. What we never talked about with kinesiopathology is the level of, look at the disc and degenerative joint disease. Now, if you can't explain to the person, as the dentist explained to me, Dr. Kaplan, the surgery, I was 3 hours in the chair. Surgery, Dr. Kaplan, was a difficult surgery. But you know what? Let's talk about doctors in our country, because see, the report of findings that orthopedic surgeons have is very simple. You need surgery. So what we need to talk about, doctors, is at the end of the report of findings, I let people know they have two options. Basically, they're either going to do decompression now, or they're going to let it wait until they have surgery. See, if the front of your car went out of alignment, what would happen to your tires? They'd wear. But what if the metal was showing? You know, and then what is failed back surgery? Sometimes known. I mean, it's very common that 40 to 50% of all back surgeries today have failed. Tiger Woods has had big six-pack surgeries. So when you say you had a bad lead, no, doctor, you were a bad educator. So care, let's go back to the word care, because I'm going to go through that in my whole talk tonight, and I'm going to put it together. The word care, commitment, clarity. You have to know when you walk into that room, doctors, that you're in charge, and that's the A. You have to be the authority. If you're weak, let me tell you, they ain't paying you. You have to go in with such an authority, doctors. I don't care if they're Medicare. I don't care if they're personal injury. I don't give a crap if they're Medicaid. Don't you understand, doctors? If you're putting negative stuff in your head, they can't afford me, I don't know if they like me, you failed. Your job is to look at one thing. Look at the picture here. The spine. What is the problem and what is the outcome? And let me tell you something. We are working on, this is going to be a killer for all our clients that are on tonight. We're putting together a magazette on failed back surgery with pictures showing them. So not only you tell them, listen, if you choose decompression or you choose surgery, let me show you what the outcomes are. Let me show you about failed back surgery. Let me tell you what the National Institutes of Health says. Let me tell you what it says. And epidural injections, I'll show you the Pindell study that did a study that shows that not only are epidurals not effective, not only are epidurals not FDA cleared, not only are epidurals not FDA approved for back pain, but let me tell you, epidural injections are the enemy. And that we know from the Pindell study that many people that have these injections, doctors, they end up with levels of avascular necrosis because you're injecting cortisone into the joint. And what we know that epidurals in the study, and the Pindell study was the largest study done on epidurals, it shows that A, relief is minimal, relief is temporary, it's not a cure. You know, when I went to chiropractic school, we said, you know, are we treating the symptoms or the cause? You see, doctors, you have to let them know what their options are. And you have to let them know that non-surgical surgery is not, it shouldn't be the fourth choice. It should be the first choice. Because to them, they go to the MD. That's why we have so many videos to educate the people. So A, confidence, commitment, and clarity is the C. A is the authority. R is the research. Where do our doctors see all the new research studies that we have? Where do the doctors see the way that we've redone everything? But when you combine that and showing them the research studies, which makes you the authority, and we utilize medical research studies. You see, Richard Branson said that there are the three I's. There are the innovators, there are the imitators, and there are the idiots. And the idiots rooting for everyone else. Listen, there are a lot of people that want to compete with Perry and myself. But let me give you this, doctors. I ran a company that was losing $1 million a month and turned them to $30 million in revenue inside of a year. Show me someone else. Don't give me a kid out of college, got his master's. I used to hire and fire MBAs all day long. And I'm going to tell you what, doctors, you're better than they are. You know why? Because they're just bean counters. Don't let anybody call you up and say, I can promise you this, and then you get a contract that says no guarantees. Don't you get anyone promising you anything, because the only one that can promise you anything is yourself. And the promise that you have to make to yourself is the commitment to excellence, the commitment to understanding what table you have and how to get the maximum results on the table. Because you have to understand, if you have a fixed tower, doctors, okay, then it puts yourself in a normal lordotic curvature. But if the table, as you look in the bottom thing, starts to move the person, you go from a lordotic curvature. Look at what you're doing. You will not get the event decompression. Decompression is not a table, doctors. It's an event where you have spinal distraction without muscle contraction. So when you have a person that comes to you and say, oh, I went to the doctor down the block, he's charging $50. The first question I'm going to say, what table does he have? What protocols does he use? We teach the Shealy protocols. We will discuss the Shealy protocols. The Shealy protocols are in the book. I don't care what table you have, doctors, but I want you to be a master of your table, to be a master of your universe, to be able to explain to the person what the outcome is, to let them know that the Bagdock study says, the Bagdock and Burdick study says that the problem was there before the symptoms even appeared. By the time they come, so when people tell me a bad lead, no, people are calling you with symptoms. You were just bad at converting them. You have to understand, healing takes time. The dentist said to me, I loved it. He said, Dr. Kaplan, it was a very invasive surgery. Healing takes time. But you know what? I might be a doctor, but when a doctor becomes a patient, we have the same expectations. Why aren't I feeling better? Right? In my mind, I'm saying, son of a gun, I paid this guy $7,000. I'm still in pain. In pain. Every day. And I'm saying, hold on. But you know what? That's why we provide you, doctors, you can take a picture of this chart. This chart shows you, okay, about what it needs, that healing does take time. And the patient, as I was a patient this week, we don't want to accept that, but it's your job to educate them that. And that's part of the word in E. Excellence is part of educating them on your technique, educating them on your ability, educating them on your excellence. That's why, listen, I'm an honored guy. I'm endorsed by Dr. Norman Shealy. I'm endorsed by Dr. Dyer. There is nobody in the country outside of myself and Dr. Bard that have been endorsed by Dr. Shealy and Dr. Dyer. So if people want to come out and they think they're coaches, let them be coaches. But I'm going to tell you, show me your resume. I will put my resume. We recreated decompression. Why? Because we understand the damage occurs. We understand that the inner layers of the annulus go first. We understand the weakest structure in the body is flexion. And that's the McGill study. You see, you guys have to know the studies and you have to know the research. And it's not just getting the books, it's mastering the books and mastering your destiny and taking the research studies and take them, knowing the Bagdock study, knowing the Shealy study, knowing the McClure study, knowing the Dio study. See, that's why research, doctors, is so important, because I'll quote it. I live for it. Listen, when someone says, I'm thinking about it, doctors, let me tell you what they're thinking about. They're thinking about you. You know, what I really loved and appreciated, doctors, is when being at the dentist is, see, what do you tell a person that has one herniation? What do you tell them they have two herniations? What if they have three herniations? Is one herniation worth more than two herniations? Well, let me tell you, I have a new clothes. I have a new clothes, Jason Kaplan. I have a new clothes. I reviewed it the other day. You know, one of the guys, he's a deacon. And I know he's on tonight. Malak, you are a pain in the ass, but you're a great pain in the ass. And I'll tell you why. Because when Malak came to me, he was nothing more than a salesman. But I'm going to tell you, this guy has a heart as big as the state of New York. Why? He wants to know what he did wrong. And every time he doesn't close the case, he'll call me up and say, Dr. Kaplan, what could I have done better? And what he's done better is he's become a better doctor. And you see, when you go to a medical doctor, doctors, they don't think whether you can afford them or not. I mean, I don't believe, you know, in some of the old coaches that gave like a 3-day report of findings. Are you kidding me? If you are focused, remember the C's, confidence, commitment, clarity. You have to be the authority. Why do you need an MRI? Here, look at them in their 20s. Okay? In their 20s. almost almost 40% have the disc degeneration in their 40s. It goes to almost 70%. Why wouldn't I show them this picture? Why wouldn't I give this? We give it to our clients. You can take a picture of it if you're not a client, but if you want this and more, you come to the event. I will change your life one disc at a time. You want to be the best? I will make you the best. You want to listen, I love all these guys out there. Hold on. You want to buy a machine? Hold on. Listen, I get the American chiropractic. Hold on. I'm going to be, why be Invisared when I can be Invisadisc? That's going to be my new business, Invisadisc. I see more people because they're not making money in their profession in chiropractic. They want to go into weight loss. Dang, guys, I was the president of the Nutrisystem. I'm giving you the best brand with the best institute where we're in 46 states with over 250 clinics. And let me tell you, don't challenge me. I'm going to challenge the patient because let me tell you something. When a patient says I'm going to think about it, the first thing I'm going to ask them, why are you here? Invisared? They dominate in marketing in our profession. Let me tell you, that's why the profession is struggling right now. They don't understand that 83% of all back injuries, doctors, 83% don't happen because they didn't understand that flexion is the danger. And then that's why we provide the McClure study. The McClure study, doctors, was done in over 700 cases of pre-surgical, 500 cases, pre-surgical. And what he found was a 91% success rate. 90, what we love in our research, in the word care, I'm providing you medical research. We are, in discussions with Life University, and we will help them, but we want a commitment that monies will go into research. There are no major research, but we're utilizing medical research. I am blessed, and Perry is blessed, and Jason is blessed that we got to work with Norman Shealy, that we get to speak with Norman Shealy. But I'm going to tell you, the close doctors, if you don't know how to do a close, every time that person says they're going to think about it, they don't want to know, you failed them. They didn't believe in you. You didn't meet the feeling of care. You didn't provide the confidence, the commitment, the clarity, the authority, the research, and the excellence. If you don't provide those four things, you will fail. And listen, they will test you. They will test you all day long. You have to know the facts. But if you're selling them, if you're talking about money, you failed. Well, let me tell you something. What's the alternative to decompression? Very simple, back surgery. Let's talk about failed back surgery. God, I'm on the internet all day today. And one of the reasons for back surgery, poor candidate for surgery. Now, I'm going by NYU, the Odell study, the Boudreaux study. It showed excellence 4 years. Listen, I can look at the study here and I can tell you what it says. 4 years later, 50% of the people were totally asymptomatic. 91% were back to a normal life 4 years later. And that's without maintenance care. And the Odell study, which was done with Odell and Boudreaux, they didn't know what we know now, doctors. They didn't utilize what we do now. And that's why, and this was in anesthesiology news. You got to provide this to the patients. No different than anything on failed back surgery syndrome. Some people with back pain may benefit from more conservative treatments. These are medical doctors saying that. Dr. Dios says that. I mean, and then why does back surgery fare? Scar tissue, doctors. Even with successful back surgery, some scar tissue forms in the area after the operation. Who told us that? He will be at the national certification. He's a friend of ours, Dr. Robert Burke. He's in the book. Perry talks about the book. The whole book on radiology is on MRIs from Dr. Burke. See, doctors, you want to sell balance equipment. You want to sell Invisared. But see, doctors, equipment doesn't win at the end of the day. People don't choose equipment. They want to go to the best doctor. And the best doctor will utilize equipment to get the best of results. If you're utilizing equipment to bring patients into your office, then you're looking for a magic trick. I can do magic tricks. Watch this. See this? Now watch this. I can make it disappear. Huh? Where did it go? That magic does not win in the doctor world, doctors. What wins in the doctor world is confidence, it's commitment, it's taking the authority to understand what you do. Spine surgery is the second leading surgery in America. I mean, and then people don't realize that 40% of whiplash injuries develop degenerative joint disease. Heck, we can increase your PI practice. And then the second surgery, doctors, is only 30% successful. And if you like these studies and you're taking pictures, wait till you come to the next boot camp. And what I love in this study here, okay, and this is by a Duke study. So when it says Duke, who is it? Of course, it's Norman Shealy. He's a Harvard neurosurgeon who said he knew after his first surgery, he told Perry and I, he knew it wouldn't work. And he had to develop it. So who did he work with? Never. He worked with Dr. Dyer. That's why the vaccine was originally done in a prone position. It was him working with Shealy that it was done in a supine position. Why? Because Shealy dislocated his shoulder in a prone position. Plus, when he realized in a prone position, doctors, where's my spine? In a prone position, doctors, what you're doing is you're pulling it at this level, but you're not doing it into the allotted without a curvature. So that's where the Shealy-Wasserman study came into effect. And they talked about how you need to have a fixed tower, which only a few pieces of equipment have. Are all equipment the same? Of course not. Are all cars the same? Of course not. Better equipment, in my opinion, gets better results. You get in life, doctors, what you pay for, whether it be in a car, whether it be in a home, whether it be in a piece of decompression equipment. Now, this is the Shealy-Caladia study, long-term benefits. Again, this goes out. Why? Because this was done, listen, all done by MDs, and we teach our doctors how to provide this. The American Journal of Medicine said 80,000 surgeries fail annually. And see, doctors, if you have that same person that might be thinking about you is also thinking about an epidural, they're also thinking about surgery. But see, if you become the guy of authority, if you become a person of strength, a person of commitment, you see, it was very funny when I went to the dentist and it was like, this is what it is, Dr. Kaplan. You know, this is what it is. And he said it with such confidence that, hey, and I wrote out the check for $7,000. And you know, and that's not for 20 visits, doctors. Do you understand what I'm saying? That's not for 30 visits. If you're scared to ask for money, it's because you're scared to ask for money. Why? Because you're not committed. You become a salesperson. You haven't become a doctor. See, if you know the research, and I can go through the studies with you. You want to talk about some of the studies, doctors? You want to talk about the length of time? You want to talk about in the book? If you go to the big book, doctors, you want to talk about contraindications? Page 21. See what he's showing you right now? I have to look at it. Shealy-Bergmeyer study. You want to talk about the NACMA study? Page 127. You want to talk about the World Health Organization and found counterfeit materials used in decompression? That's on page 135. You want to talk about how the adjustments can help? Page 143. You want to talk about Shealy, McCall. What about neurology? What about drugs? What about neuropathy? Think about what I'm telling you, doctors. I believe that we are the best deal in town. And I'm proud of that. My legacy is not just my son, Jason Kaplan, and my daughter-in-law, Stephanie Kaplan. It's what I brought to the profession. See, DRX failed. Why? They promoted a machine. And that's why these people that promote equipment, they will fail. We promote a brand. Nutrisystem, they never called me up and said, how's the food? They bought into the brand. And when we come out with our new thing on failed back surgery syndrome, and we give them a take-home thing, which we will have to all of our doctors in upcoming boot camps, okay? And then they will learn about why back surgery is deadly. 1 in 50 back surgery patients dies within 3 years of the surgery. And for the ones that don't die, they have problems. They go for 2 surgeries, 3 surgeries, 4 surgeries. It's about age. People that fall have problems. And that's what we talk about. Yes, there's a power to balance. And yes, there's a power to neuropathy. But you have to do it in accordance. And you have to create it properly. That's why we're looking to add other diagnostics like thermography. They did a scan that can show inflammation right out of the gate. What does it take to do? 2 minutes. And then when people know, scar tissue formulation. Oh, God, I go through my notes here because I went through so much. Here's what I love. Causes of failed back surgery. Watch this. You ready, doctors? Incomplete surgery. Sometimes the initial surgery may not address the problematic area. Watch number 2. Scar tissue. Watch number 3, which I love. I see this all the time. Recurrent disc herniation. They go in, they get a microdiscectomy. 3 months later, they come back And guess what? Now the doctor says, oh, it's another disc. See, doctors, what do you do if there's one disc, two discs, three discs? You come to boot camp in July. You come hang out with me. I will show you what to do with these cases. I will show you how to close these cases with such a level of confidence, such a level of commitment, such a level of clarity. That's what we do, and we do it better than anybody. I challenge anybody to know as much better. Don't have somebody call you up and tell you they're going to make you more money. You make more money, doctors, by being a better doctor. You make more money by being more committed. Look at this statistic here. Are you kidding me, doctors? Look at this right in front of you. Thank you, Perry, for giving me this. I want to show patients these pictures. Here are your examples. I'm going to give them the McClure study. I'm going to show them this. These are your choices. Is this what the risk you want to take? Because let me tell you, when I show them this balloon, that thing keeps bubbling. Can they see that, Perry? Can you see it?
Bet. You bet.
That thing's going to pop. And when it pops, you end up on the floor. I'm going to listen. Do you realize that back surgery is a billion-dollar industry? Why? 74.6% of back surgeries fail. And that's in the Journal of Pain Research, not from Sherman, not from Life. But see, chiropractors are weak. They lack confidence. They want to, oh, I don't know if they can afford me. Oh, I didn't get a good lead. Oh, they didn't get, listen, it's not about whether they're Medicare, Medicaid, cash. It's about their spine doctors. You have to be able to look at that spine and tell them what the problem is. According to another research, it studied 80,000 people yearly are suffering due to back surgery failure. Now, I know Jason, if he got on, he'll tell you, he gets a lot of those cases. And I'm going to tell you, as good as I am, my son has made me a better doctor. As good as I am, because I'm going to tell you, between Perry and myself and Jason and his son now, nobody knows and treated more cases and looked at more MRIs and looked at more x-rays than we have. And I love doctors that are not clients or are past clients. You might be on tonight and they want me to give you my opinion for free. No, you're paying for the brand. You're paying for the confidence. You're paying to have this. Any one of my clients can call me anytime and show me any MRI, and I will discuss it in detail. My son does the same. But you see, doctors, that's the clarity. You see, we have to also know that chiropractic works. The Kirklady study said that. The Kirklady and Willis study said that. The IMA study. We talk about timelines, doctors. People are scared to offer, or they offer too much. Why? You have to know that the studies, Shirley Bergmeyer was 6 weeks, Nagelsmann was 20 sessions, Ramos was 20, Beatty was 24, Nagazewski was 20 to 35, Ironman was 40. See, I follow the research studies and I provide those studies. And then I'm going to give them this in my new patient fall that we give them. After doing my first back surgery as a neurosurgeon, I knew that back surgery wasn't the answer, so I spent a great portion of my life finding ways to avoid back surgery and develop non-surgery. I found this FDA-cleared equipment to be a game changer. The only company I recommend is this in America. I challenge anybody to get that. And I got the same thing from Dr. Dyer. Why? Because he knows that Perry and he knows that my son and his son are committed to taking the profession to another level. I've told this to the heads of Life University. I've told this, I spoke at National University. I spoke at Parker University. Listen, decompression was dead. And all you people out there, listen, what is one decompression case worth a month worth to you? What's one case worth to you? Let's say $4,000. What about knees? What's one case worth to you? Do you think a person comes into you with a knee problem and they're not committed? If you're not committed, they're not committed. I go back everything that we do. I know Perry's getting ready to go on. When I see that beautiful face of my greatest partner in the world, the king of new patients, because if you want to talk about the capture, but doctors, it's about care. So we talked today, I started with the 3 C's. Capture, the conversion, the close. And then I talked about care, confidence, commitment, and clarity. I will promise any of my doctors that come to the next boot camp, I will put together. Perry and I are working on it today. Why? Because I always say this. Perry knows my book. The road to success is always under construction. I love Dr. Deacon, Dr. Block. He calls me up with his failures. Not the ones he tells me, oh, Dr. Kaplan, I listened to you and I closed this one. Oh, Dr. Kaplan, I listened to you and I closed that one. And you know what? He's making more money. And he calls me. And I that's why everything doctor starts with statistics. If you can't measure it, you can't manage it. So confidence, authority, research, and excellence. That's what you have to be, doctors. And if you can provide that, if they know that you are the best doctors, and at the end of the time they're thinking about, I ask them what they're thinking about. I said, you have two things to think about. Here's what I'm going to leave you with. You can either live your life the way it is now, but if you were happy, you wouldn't be here. You can make a change in your life, and we have to start right now. Because for the front of your car with alignment, what if I told you the metal was showing? Because let me tell you something, a herniated disc will rupture. And when it does rupture, I'm going to give them science and statistics of where they will be. And if you don't have the guts to do that, then you're not being a great doctor, because that's your job. How many of you have ever went to a doctor, an orthopedist, and before he said, oh, you need an MRI? Who says to an orthopedist, well, how much is that going to cost me? See, you're worried about whether they can afford you or not afford you. You failed. Here's what you need to worry about. Did they trust you? Did they believe in you? Are they committed? I'll look you anyone in the eyes, and I promise you this. If you're a client, you come to the next boot camp, I will make it the best day of your life. I'll look you in the eye. I will tell you if you're not a client. If you come to one of the events that I'm doing in July or Chicago, which I'm almost sold out of, I think in July, I think I have 2 seats left. And I think in Chicago, I have 2 or 3 seats left. And that's it. But I will promise you, doctors, if you haven't been in my presence, if you want to be the best, I will promise you this. I will make it the best day of your life. I'll stay with you, you do. Why? Because the enemy of great is good. And I'm telling you, we, Perry and I, with my son and his son, Jason and Devin, and my daughter-in-law, we're changing the world one disc at a time. Why? Because we understand the word care. We're committed. We're confident. With the authority. We provide research and excellence. I'm Dr. Eric Kaplan saying, I love you. Let's take this game to another level. Let not be that we become alternative care. We should be the primary care when it comes to back problems. Love you and appreciate you. Go ahead, Perry, take over.
Well, you know, it's so funny because you're actually not done yet, because I'm bringing you back for an encore. And there's a reason why. There's actually a form I would love for you to explain to the doctors, because I have some forms. So did you learn a little bit about? So let's roll the tape back a little bit and let's just recap some highlights. Okay, so in other words, I had like 15 things that like jumped out at me. Number one, I got to tell you, come on. The McClure study, right? The McClure study is the gold standard, really, in non-surgical spinal decompression, and we showed it to you. And the Odell study, and then the Shealy-Bergmeyer study. Now, there's other studies out there, like the Ramus and Martin study, the Pedruzzi study, the Nachman study, which is actually showed different positions of spinal disc pressure. Did you ever notice, like, I don't know if you're like me, but like when I go to the gym, tell me if you're like this, but when I go to the gym and you'll see, this is what drives me nuts. Tell me if this drives you nuts. You'll see people like doing like, they're lying on their back and they're lifting their legs up, right, together, right? Well, aren't you like screaming it? Like, that's like, that's like a Laseg's test. That's like a straight leg raiser. They're increasing intradiscal pressure, they're increasing intrathecal pressure, and if that disc is on the verge of blowing, that disc will blow just from that. But you know what drives me the most nuts? Tell me if you're like this. When I see people in a gym do hyper extensions. Now, I know me personally, if I do a hyper extension, I'm lit. My back is lit the next day. So one of the most important orthopedic tests, it was the gold standard in my office. And remember, I had 5 clinics, 4 at one time, sold them off, then opened another one, sold that off. It was so crazy. I show pictures and stories always at the Chiro event if you're fortunate enough to grab a seat. And by the way, there are 3 seats left for July 12th. There are only 2 seats now for Chicago. So just so you know where we are, go to the website. You can call the number 888-990 9660 to try to scoop up a seat. And then we've got some gifts for you. So I'm so glad that you hung out. There's actually more people on now than when we started, which is great. But when you go backwards, you know what that is? That's a Kemp's test. And the Kemp's sign, if you remember, with a little bit of rotation, in other words, extension, hyperextension, and a little bit of rotation, because let's call, as Dr. Kaplan says, a spade a spade. I love when he says that. Did anybody ever walk into your clinic, ever, in your history of treating non-surgical spinal disc cases, did they ever walk in in a hyper extension position. Do you know what I'm saying? They're walking, did they ever walk in like that? No, they're all in different degrees of antalgia. Why? Because that's opening up the nerve root space. So if you were to forcibly move them back into extension, they're going to be lit up. So you got to do things to get that disc calm. You got to do things to cool that disc down. You got to do things, and that's one of the things I love. If you go to Dr. Jason Kaplan's office, 1,700 square feet, multi-million-dollar practice, incredible. Every room is monetized, by the way, and he's going to be in Chicago, by the way. Yeah, for those who want to know. So I'm going to show you some stuff, and then I would love for you to take some pictures of this stuff, because then we have some cool gifts and some fun stuff, and then other things I want to talk about real quick. So let me just do this real quick. Can I share my screen? Let's go. There it is. All right, perfect. Can you see that? Yeah, let's go. All right, so there's 3 forms we want to pay attention to. Number 1, it's called the spinal disc disorders form. This form actually is in every new patient package that we give to the patient. Now, why? Because as you remember, what Dr. Kaplan before showed the phases of spinal degeneration. Remember phase 1, phase 2, phase 3, phase 4, and all the different osteophytes and levels of degeneration and loss of curve, and even to the point where it starts to fuse. You know what I'm talking about. So we do the same thing with spinal disc, and every patient needs to know where they are. Are they stage 1, stage 2, stage 3? Because if they are, now you know who does this the best? The best are the dentists. The dentists are the best in the world at selling, if you will, the future. In other words, explaining the future. In other words, obviously, once a tooth starts to become infected, you get a hole in the tooth, you get a cavity, try to get that repaired. What happens? Often they'll go for root canal. If that fails, what happens is that becomes an extraction, and that becomes potentially an implant. So the goal is to try, now do you know once you have an extraction, there's a higher likelihood you're going to lose more teeth? Did you know that? Just kind of like discs. Did you know that once you have surgical repair to one disc, it has the potential to affect other discs? So 3 forms, that's the first one. Number 2 is the activities of daily living. And this is such an important form. This is in every new patient package. Every patient needs to fill this out, because you always need a starting point, because we always tell the patients, we need to know where you are. We need to know where you've been. And that gives us an understanding, Mr. Jones, as to know where you're going and what the future has in store for you. And hopefully, we caught this at the right time. Now, a lot of this is predicated on the consultation. That's why we put so much information, so much education, and so much content on the consultation. Asking better questions, using better forms, bridging, explaining, overcoming objections right there, using a best day 1. Our new day 1 materials are over the top. Our day 2 materials, unmatched. And if you're curious, you say, well, gee, they're showing a lot of stuff tonight. Yeah, you know why? Because we have all new stuff. I'll talk about that a little more. Here's another important. It's called the back index. Now, some of you own non-surgical spinal decompression that actually has an oswestry in it. There are certain tables that actually have that. In other words, the machine won't turn on until you put an oswestry. If you're curious about that, you can call. We'll go into more detail, explain the different biomechanics of tables. And, you know, the bottom line is you should know what you bought. You should know how to extract a better patient outcome. You should know how to deliver a better patient outcome. And you should know how to underpromise and overdeliver. That's in communication. The reality is, if we could teach you how to communicate a little bit better, and that's what we do, especially at boot camps. That's my favorite with the Cairo event. Of course, you know, the boot camp is all nuts and bolts, meat and potatoes, and especially the amount of new content. By the way, mark it down. July 11th is the boot camp. There are 2 seats left. And so if you don't have a seat, grab a seat. If you are part of our family, you come for free. Remember, boot camps are always free. You can come to as many as you want. They're done at our corporate office. And there are 2 seats left. So we would love to see you on July 11th, because guess what? There's a reason we have all the new materials. We'll talk about that at the end. And Dr. Kaplan, Dr. K, can you just do me one quick favor? Can you talk about theirs? These are actually 2 forms. There's actually 2 forms that need to go in the new patient package. And you touched upon it before, and you know what I'm talking about.
Yeah, you know,
I'm talking about the epidural. Can you go into a little detail on I'm going to bring up that slide, and just if you would talk about that, because I think a lot of people are under the impression that they're FDA approved for back pain. They are not. And there's a lot of potential issues, problems, concerns from it. So
It's done as an off-label device. Of any of our claims that don't have the Dr. Oz video, we will give it to them. Why? Because we take care of our clients. We provide them things that we can. But you have to understand that when people come into your office, doctors, pre or post surgical, that's why, see, you can't, doctors, just go to doing a report of findings when they come into your office. You can't. It's the easy way. Think if they bring in their MRI and you look at their MRI and you sit down with them. No. Even if you spend 5 minutes, doctors, and examine them and do a Lesage and do a Braggart and do a Fitzpatrick and do a Kemp, those 5 minutes are a game changer because you have to develop that confidence. If I came into a room, it would be no different than buying a car, and now I have to sit down with the money person. That's who you are. You want to be the money person, or you want to be the doctor? I have never gone to, and I've been to orthopedics, I've been to dentists. The dentist has to touch and tell you what the problem is. And what he did is, Perry said, he explained the future. He said, Dr. Kaplan, you have an abscess. And my thing is, well, give me some penicillin. I did that for 2 weeks. Then he said, well, Dr. Kaplan, do you realize that if we don't take this tooth out, which was a failed root canal, which has changed over time, that what's going to happen, doctor, is this could give you heart disease. This could affect your heart. This could give you sepsis. People can die from this. Well, you know what? At that point in time, he had me. And I'm going to tell you, I'm not going to lie to you. It hasn't been easy. And I love when he said it takes time. And see, people think that an injection, doctors, and the Pinnell study shows you that epidural studies, A, are temporary. B, not only effective. C, they can cause other problems. And that's what you can't mask the symptoms. I mean, the bottom line, doctors, is if you have a bone on a nerve, you have to open that disc up. I was with a pro today on the golf course at Trump, who Jason is a patient you treated, Sean. And many times what Jason doesn't realize is I'm always educated because when I'm on the driving range, I've had my 20 treatments. What do I do now? I said, and Jason has taught me this. I said, now you need to let the disc rest a little bit. Why? Because you're pulling on it, doctors. Every visit, you're pulling. And see, doctors, surgery, scar tissue is the enemy. The decompression, it's the friend. Because, see, scar tissue develops wherever they cut, whenever they made the incision. When we do decompression, doctors, the scar tissue starts to keep the space wider and keeps it solid. And that's why, doctors, when you show them this and give them what the FDA, because, see, what I asked the patient in your report of findings, well, if you don't choose decompression, what do you think your options are? See, it's always good there. So I have examined them. I felt muscle spasm. I had positive tests. I can do an exam in 3 minutes, doctors. 3 minutes. If you won't spend 3 to 5 minutes touching the patient, you will fail. Your close rate will not be as good. I'll bet on it. And I've done more of this than anybody in the history of this country in showing closes. Why? Because I know what I'm doing. Why? Because I've been a patient. The greatest thing about listen, I remember when people used to come to my office and they had back problems, Perry. I remember this, and you worked for me. You know this. And I would say to them, don't be such a baby. I said, and in those days, I didn't know about disc injuries, doctors. I'm not going to lie to you. And I said, come on, let's put you on your side. Oh. And they'd go be like this. Oh. And listen, the arrogant guy that I could be, and I can be, I say, don't be such a baby. Come on, let me do it. And because we know, doctors, and the Kirkley Willis shows that manipulation does help. But you know what? But decompression took it to another level because, you can get the vertebrae in line. When we spoke to Dr. Shilley, he talked about he says, if you have a back problem, he says, what separates you guys, Perry, he said to Perry and I, he says, is you understand the power of the sacrum. And if you have a pelvis that's out of alignment, you will have a subluxated sacrum. So here you have an orthopedic surgeon who taught at Harvard University, and he's telling Perry and I how he adjusts the sacrum. He called it a sacral shear. We called it a sacral subluxation. It's in the big book. But he loved the fact that we understand that if you take a vertebrae, and I'm looking at it, and the pelvis is out of alignment, let's say like that, doctors, okay? If you don't get the kinesiopathology removed, you can pull that thing all day. That's why medical doctors can't master decompression, and that's why you can. But what do you have to do? Doctors, about care. You have to care for the patient. You have to care about them. You have to care about your life. You have to care about your success. Let me tell you what a patient's like. It's like a little baby. You got to love that little baby. You got to hug that hello, little baby. I'm going to make you feel better. I'm going to help you today. Okay. And how do you put, you see, imagine if a baby cried and you didn't hold the baby. When a patient comes to you, they're crying, doctors. They're crying for attention. And if you don't touch them, they're not going to feel your confidence. They're not going to feel your commitment. They're not going to feel your care. You have to show them that you're the authority. So whether it be epidurals or whatever, when they come to you, they're thinking about their future. And you have to paint the picture of what their future can be with you or without you. We good, Perry?
I got some cool stuff to show.
Good, because you're running out of time. I'm giving you
And to
5 more
answer your
minutes.
questions, actually, I'm getting texts, so I'm going to answer your questions live. They're down to, it's 2 seats now. It's 2 seats in Chicago that are left, and there are 2. They'll probably be gone by the end of the next 10 minutes. But 888-990-9660 is the phone number. You have the website. I'll show them one more time before we go. But to answer your question, yes, to all of our family at this Centers of American Doctors, because so many of you are live with us here. If you send me an email tomorrow, I'll get you the camera-ready versions of those forms as you've asked, okay? So you can start plugging and playing. I'll get you that copy, and you can, and remember, if they need to be modified, we do that for you for free. You know that. Always, always, always. And so what I'd like to do is I want to show you something. And to answer your other question, is one of the texts I got is very cool. Thank you. Is why it says it sounds like something cool is happening, and you probably figured it out. All right. So let me tell you before I show you is the reason that this upcoming boot camp is very unique, very special, very historic, July 11th. And again, if you're part of our family, you get to come for free forever, for always in a day. Is there is an abundance of new tools, new patient folders, new magazettes, new research studies, new business cards, new ads, new inserts, new not just folders, but just a host of new handouts, new forms, new financials. And you're going to go, wait a minute, what the heck is going on? Why the tsunami of all the new stuff? Well, for those of you who have been paying attention long enough, many of you know, you've been with them before he started day one in chiropractic school. Our son, within 2 weeks, will be opening a 2,100 square foot DDG office, drop dead gorgeous office. And we cannot wait to share it with you, show it to you, explain it to you. And, you know, he had the greatest role model in the world, still does, Dr. Jason Kaplan, who's the OG. Is that right? Like the original gangster? Is he the guy in this? Yeah, he's there. That's why if I'm in Chicago, I'm buying a plane ticket just to hang out with him, personally, just saying. But no, listen, he owns this. He could take the machines apart. He could put them back together. He understands every nuance, everything with patient belting, patient angles, patient management. He's the king of that stuff, and he owns that. And you know, our son is basically, you know, opening a brand new practice. So it's so exciting. So we wanted to make sure that all the new stuff for Dr. Jason Kaplan and Dr. Devin Bard, they're hitting the ground running. So Dr. JK, I will blow your mind. Wait till you see. We've been working long and hard on this. I mean, late hours and so much ping-ponging back and forth, but the materials are gorgeous, and we cannot wait to put them in all the doctors' hands July 11th, and then obviously every boot camp thereafter, and so on and so forth. So let me show you this real quick, and then we're going to go into it, and let me tell you what to do, how to do, why to do, and what you need to do. All right, so obviously it's not a secret. If you say, well, gee, you know, this Dr. Kaplan and Dr. Bard, they're a little different. Obviously, they got a lot of energy. Did you know, together, you know, we've been in this business for over 80 years. Well, why do we have so much energy? Maybe it's the way we eat. I don't know. Maybe it's the way we work out. Maybe it's the way we feed off each other. Maybe it's our passion for being a chiropractor. Maybe it's because the future is so bright. But the reality is that most chiropractors, they try to take one little piece of bait, they try to fish in one little part of the lake, they hope to try to get one patient. And we said, you know what? That's not for us. What we decided to do is we want to throw the widest net. Yeah, these are your neuropathy cases. These are your knee cases. These are your disc cases. These are your multiple disc cases. These are your personal injury cases. These are your good eating fish is what I'm talking about. You know what I mean? I don't know if you eat sushi, but this is your bluefin tuna. Yeah, this is your bluefin tuna. If you want to be in the decompression world, you're no longer in the minor leagues of chiropractic, trying to sell a $500 care plan, wishing, hoping, praying that they say yes, and then try to figure out how to get them on care credit. No, this is a cash model that we teach. July 12th in South Florida, July 26th in Chicago. And the reality is also that we're in the business of making better doctors. So one of the things you always have to do is to rely on the diagnostics, make a differential diagnosis. Is this a non-surgical spinal disc case? Is this a biomechanical case? Is this a hard bone on a soft nerve? Is there one disc involved? Is there two discs involved? Is the disc prolapsed? Is it protruded? Is it herniated? Is it sequestered? Yes, you as the disc specialist, and this, let me tell you, if you think you roll out of bed and you learn this, no, this is a graduation, and you do so by getting in the right environment with the right training, the right tools, the right materials, and that's what we're going to put in your hand. As a matter of fact, we're going to show you exactly what we're going to put in your hand right here, right now, because if you know how to create multiple income streams or multiple streams of income, and you might say, well, gee, how do I do that? Well, if you have a disc business, that's a business in a business. If you have a neuropathy business, that's a business in a business. If you have a knee business, that's a business in a business. Let's say you do weight loss, that's a business in a business. We can go on because as specialists, as a DC, as a disc chiropractor, decompression chiropractor, DC, you have the ability to put all these things under the umbrella. Write it down, 888-990. Call that number now. Don't fool around. You want to come, get that seat. If there's left. Now, to answer your question, I'm going to answer your question here. Thank you for sending it. Is once the seats are gone, they go to a wait list. The problem, though, with the wait list is 90% of the time, the wait list does not open. Nobody gives up their seats. And if it does open, it's usually 48 hours before. That means you got to buy a plane ticket, and it's not as easy. But obviously, people, if it's me, I'll planes, trains, and automobile, I'll do whatever it takes to get the content. See, to me, I know one piece of information, one nugget, one golden nugget can change everything. So, we'll light up your to-do list when you get to the Chiro event. So those are the two dates, Saturday, July 12th, in South Florida, one time only, corporate office. It'll be so much fun. It's going to be, and obviously there's going to be doctors there from the day before that are family doctors that are attending that as well. And they come for free anyway. So they're all grandfathered in. So they already scooped up a bunch of those seats. If you're curious, you say, well, gee, why are the seats gone? Because the seats actually go to our family of doctors first. They always get first access, but you can buy your way in. Yeah, it's $249. Best $249 you've ever spent in your life. If you can't afford $249, I'll loan it to you. If you're worth it, if you can't invest that in yourself, then you don't see the value in your investment, because you're not investing in you, you're investing in your patients. That's what you're investing in. You're investing in your future. You're investing in your tools, your ammunition. We call our ammunition the weapons of mass production. Yeah. If you have better tools, better content, better materials, you'll fill up your appointment book. It's that simple. And we've been blessed. I could show you hundreds of doctors. Some of them are on here right now. Yeah, Dr. Mark Lisagio, the king of knees, Bethlehem, Lehigh Valley. Oh gosh, we get the best of the best. All of these doctors share something in common. They all went to the Chiro event and they took the tools, materials, and listen, you want to join our world? You got our number, call us. And if your area is open, we'll talk about you joining our educational group. But we attract a certain type of doctor. We attract entrepreneurial doctors. We attract doctors that understand that this is a business. In other words, that chiropractic is a business. It's a philosophy, art, science. And yes, it is a business. Those are the two dates, July 12th. In South Florida. Write it down. Try to scoop it up if you get a chance. It's going to be a blast. We're so excited. That's actually, that's the phone number. You can call Lacey, you can call Stephanie, you can call Michael. A lot of you know Michael. Michael will be there, as a matter of fact. And Michael will be there in Chicago with us. He's actually flying up. You'll see him at boot camp.
Oh, no.
You'll see. You'll see him, and Michael will take incredible care of you because that's his background, and Michael's an extension of us, and we're excited because it is one big family, and we're all in it together. We're in it, as we say, to win it, and that is because we take this very seriously. If you haven't figured out that we take your success very seriously, you're on the wrong webinar. But guess
Because
what?
we care, Perry.
You're here. We
It's all
continue to
about
grow
care.
because we care. The reality is you're on the right webinar at the right time, the right place for the right information with the right educators looking for that right training. And that's the training. You got the 2 dates. I gave you the 2 dates. Hopefully you wrote it down. Hopefully you remember. There they are. And here's one of the cool things. Oh, I'm sorry. I went backwards. I got so excited. So by the way, I didn't know if I told you this, but those 2 books, remember we talked about in the beginning when we started this, these 2 books, the one is, I think, is like 200 pages, 250 pages. It could be more.
300.
Not that thick. 300. It's pretty, and it's glossy, and it's gorgeous, and it's beautiful. And listen, if we just gave you that book, end all, be all, game over, you win, you'd be incredibly happy. But guess what? We're not only going to give you that book. It's our gift to you. You owe us nothing. We're going to give you this book as well. So that is like 700 pages right there. The actual physical books where those research studies came and all the graphics and the content and the tools and the epidural information. But in addition to that, what we also do is we're actually giving you over 1,000 pages of materials. Yeah, we give you a 400-page book. One of my favorite books, a book that Dr. Kaplan wrote, it is on cellular health. My favorite part of the book is it teaches you how to explain chiropractic on a cellular health level. And he does that so eloquently, and he does it so passionately. And he wrote a 400-page book. Actually, it's called Awaken the Wellness Within. We give that actual physical copy. We try to weigh your suitcase down a little bit when you get back on the plane, but we don't mind doing that. We also give you our blueprint or our map or our guide or our instruction. The one on the left, that's 200 pages, and it's laden with examples and just tons of stuff. It's really kind of our behind the scenes look as to how we build this, brick by brick, inch by inch, as they always say, inch by inch, it's a cinch. The one on the right is interesting because it actually has ads, and it actually has verbiage, and it actually has like some scripting actually that you can use to talk to patients. The 5-minute motivator I love. He actually did it in a 1-minute version as well. And then of course, how to treat veterans. In other words, how to get into veterans groups. Those are all our gifts to you. And guess what? We have more surprises. We got to have some surprises for you, right? So July 12th, July 26th, those are the 2 dates. This is your last chance. This is it. The clock is ticking. And see how I already knew the clock is ticking. See, that's how that works. See, the clock is ticking for all of us. It's not just clicking for Dr. Kaplan, myself, and everybody. It's clicking for everybody. In other words, that there's a window here. There's an opportunity. And if you don't see the opportunity, then guess what? Then you're literally standing on the sidelines watching the parade go by. And not only are you not in the parade, well, we took, tremendous pride in not just being in the parade. We said, we got to lead this parade, and let's bring as many entrepreneurial chiropractors on our rocket ship to be able to give them the tools, the ammunition, the weapons of mass production, and the information and the training and the education, so that when they go back to their office on Monday morning, they've got a game plan, what to do, what to add, what to change, what to modify, what to enhance. Yeah. It's that cool. And I think the goosebump moment for me is the look in their eyes. I think the goosebump moment for me is when we give them, and then we see that look in their eyes, and they're like, whoa, this is like way better than I thought. But as we always say, listen, how you manage your time. And my favorite thing that Dr. Kaplan does is he starts every lecture with these words, and he says, I'm not here to give you your money's worth, although we'll give you your money's worth 100 times over at the caravan. 100 times. Yeah. Understatement. He's here to give you your time's worth, because time is more valuable. And if you understand how to manage time, you understand how to get more. See, a lot of doctors ask, they say, how do you get so much out of the day? Well, we talk about that. How do you manage the day better? We talk about that. How are you able to get so much stuff done in one day? Well, there's not enough hours in the day, but there is a secret sauce that we use. There is a plan, and I'm happy to share it, because life management, time management, practice management, financial management, all of that runs together. These are the 2 dates. This is the last time you're going to see this. The clock is ticking. Get your hands on it, and write the phone number down. And if you don't have it by now, this is your calling. This is your chance. We always talk about how we're not for everybody, and we certainly don't want to be for everybody, because we always talk about how, if there's an old saying, if you try to be everything for everybody, you often end up being nothing to nobody. Nothing to nobody. And I've never gotten in this business to be nothing to nobody. I got in this business to be special. And the doctors that I'm looking at right here, right now, if you want to see special doctors, holy cow, I can go down the list from Dr. Delgado, who will be there in 2 weeks. Oh, congratulations. I think you're on your 83rd birthday. How cool are you, man? And Dr. Mitchell was so excited to see you. Ring of Honor, Dr. Dierdol. Oh my gosh. Oh, by the way, Dr. Dierdol. Oh, I'm so glad you're on. If you want to join us for dinner Saturday night in Chicago, yeah, you and your wife, because guess what? It wasn't that long when we met your wife and yourself in Chicago. You're a cool dude, and it's a private dinner. So if you want to hang out with us in Chicago, reach out to me. See, look, how cool is this? It just keeps going. Yeah, yeah. Green Bay doctor, you're an amazing dude, man. And I can go on and on. Dr. Kenneth, you have a call with Dr. Kaplan tomorrow, Dr. Shoemaker. Best story of working in your house and now having one of the most gorgeous offices I've ever seen in Bettendorf, Iowa. Dr. Dickinson, can't wait to see you, Dr. Gray. I mean, I can just go through the list. I mean, I'm not going to do. There's a legend, Dr. John Grossom. For those who don't know, his father was, can I say, Hall of Fame? Yes, you're talking about Dr. Ian Grossom, and he's part of
My best friend.
So yeah, one of your best friends. I mean, I'm so
I'll tell you, people don't realize he was Sue Williams' right hand, and without him, Life University would not have been Life University. He's a legend, but I will tell you, what I learned from Ian Grossom is not only did he walk the walk, he talked the talk. Ian, who treated hundreds upon hundreds of people a day, honestly never did it for the money. And that's what I try to tell people. If you're doing it just for the money, you're a salesman. When I did the commencement address at New York Chiropractic College, I said verbatim, if you're always chasing money, you're a slave. If you can teach money how to chase you, you become the master. My goal, doctors, is I will teach you how to master your life, how to master your practice, how to master your destiny. So, Dr. Barr, with love and appreciation, because I have an early dental appointment tomorrow, which I'm going to have to write out another check, I'm going to say good night now.
How cool is this? We do what we love what we do, and I don't think it's a coincidence. For those of you paying attention, and for those of you we have 4 sons, and some of you know who they are, and some of you will meet them for the first time ever. It wasn't a coincidence that we had 4 sons. All of them became doctors. All of them became doctors, and what that means is Dr. Kaplan's 2 boys, amazing. One's a medical doctor. One's a chiropractor that I'm looking at right here, right now. He's the coolest dude on the planet, and a phenomenal father, and a phenomenal husband, and just a phenomenal, oh gosh, I don't want to see go to get too big, but Dr. JK is really, he's a heart-driven doctor, that's what we attract. Our 2 boys, well, heck, one is the new sheriff in town, as we said, and he's getting ready to open his practice. So exciting. The other one is a dentist, by the way. Yeah, the other one is a dentist. And you know what? If you ask the dentist, why did you because first generation dentist in our family, why did you become a dentist? His answer was he actually fell in love with the cash model of dentistry. In other words, he liked how user-friendly it was. And he didn't want to play the insurance game, which is, incredible, foresight to know this. And that's the disc business. The disc business is a cash model. And if you know how to explain it better, if you know how to capture a better market, if you know how to overcome objections better, if you know how to paint pictures visually with metaphors and examples and tools. See, that's why the boot camps are freaky, nuts, crazy. Wait till you see what's going on July 11th. I hope you can grab a seat. So July 12th, if you're not part of our family, this is your chance to grab a seat. This is your last chance to grab a seat, July 12th. You just go to thechiroevent.com. You can try to scoop up that seat if there's any left. If you get a pop-up and it says sold out, and then there'll be a little checkbox. Do you want to be added to a wait list? That's a yes or no. We hope you say yes, but again, there's no guarantees that you'll be able to get in because nobody as a general statement, gives up their seats. And then Chicago's going to be a blast because you know why we go to Chicago? Dr. Kaplan happens to like the food in Chicago. So we're excited for that, and we're planning the menu, if you know what I mean. So, and then we do we do a private dinner for our doctors that night that are hanging out with us. And the other Dr. JK will be there. Yeah, Dr. Keeler, can't wait to see you and Mom there. Yeah, MMA fighter. Yeah, champion MMA fighter. He's part of our family. Yeah. And you'll meet him, and I'm so happy to recognize him because he's quite the guy. I mean, and I could say that for so many of our doctors. Did we have fun tonight? If we did, go like this, go like that. Yeah, we had some fun tonight. We have so much in the pipeline. We're so excited for you. Thank you for your kind wishes. Do you like the setup here? It looks like a recording studio, right? For those of you who don't know, I did work in the largest recording studio in Manhattan at my last year in high school. So, that's why we started with the Who album today. We're closing it out with your CTA. The CTA is call to action. If not now, then when? If not you, then who? If it is meant to be, then this is the time, and this is your chance to do it. And life will give you chances, but at the end of the day, you, doctor, have to pull the trigger. You have to have the bravado, the gumption, the courage to stand up for your patients. And I'm looking at doctors right now here and you know who you are. That I promise you, if I had a blown disc, herniated disc, a radiculopathy, a sciatic condition, a herniated prolapse, protruded disc, if they're telling me I need a back surgery, a laminectomy, a spinal fusion, a foraminotomy, metal in my back, epidurals, and so much more, my quality of life was going to go down the tubes. I promise you with all my heart, I would call these doctors because they constantly are students of this game. They constantly work at making their presentation, their packaging, and their experience for the patient better. And that's what this is all about. It's about making it better. You're in the business to create a wow experience for your patients. That's what we teach. That's what our commitment. That's our mission statement, is to underpromise, overdeliver you, so you can underpromise and overdeliver your patients. We practice what we preach. We preach what we practice. We own it. We live it. We breathe it. And we want you to do the same. And thank goodness you do. So thanks for hanging out with us. We cannot wait to see you either July 12th or on July 26th. You will not forget it. Thanks so much for hanging out with us. It was a blast, and hope to see you there.